Today I'd like to show you a treatment performed by a colleague and friend of mine, Kasia, who runs her own salon in Glasgow's West End, and it's called Esteem Beauty. Now this treatment, some of you I'm sure have heard of, you might even have had it done, microneedling. So it was a treatment that I'd read about, I was familiar with it, but I hadn't trained in it personally. And also when you haven't trained in a treatment and it's not something that's on your radar to do every day, you'll have a basic knowledge of it, but you don't know the ins and outs and you're obviously not an expert in it. So Kasia's going to perform the treatment here on her model, and I'm going to chat you through what she's doing and why. It was really interesting to watch and I hope you enjoy it as much as I did. So after a consultation, Kasia prepares the client on the treatment bed and begins by cleansing the skin. So as you can see, it's a nice deep cleanse, and it's to ensure that there's no makeup on the skin, there's no residue just from being out in the open air. It's also a tactic that we use in our industry if anyone is receiving a treatment and they may be a little bit wound up, they might be nervous, they might be apprehensive. Although the cleanse is performing several elements, obviously preparing the area, it also gets the client used to your touch. It's a relaxation tool. You're still using a lot of your massage movements. So it's actually, from a psychology point of view, also helping to relax the treatment area, relax the client. And at this point, they can still speak to you about any questions they've got, any concerns, and you can be chatting them through. So a nice double cleanse. I asked Kasia if she wears the gloves all of the time for the treatment, even when she's not using the needles. And she feels that because it's a medical edge to this treatment, you're using the needles, she feels it's paramount to wear the gloves at all times. You're using different products that have different results. You're about to use an anesthetic cream. So you can understand then why, when you're doing a medical edge treatment rather than a spa treatment, there's going to be gloves involved. So after removing the cleansing product, the skin is prepared and ready for an anesthetic cream. So this is why you have to go to somebody such as Kasia at Esteem Beauty, who really is trained in this. They are not just performing a treatment and you're not 100% sure of the qualifications, you're not sure that they understand the treatment process. Because you have to numb the area, you need to know that the person that's performing it really knows what they're doing. So as you can see, there's a thick layer of anesthetic cream being applied to the treatment area. It's got to be a thick layer to make sure it covers the area well. It's also got to be a thick area to make sure that it numbs effectively. And you really want to leave it for 30 minutes to make sure that it has its full effect. Now again, I asked Kasia during this 30 minutes, is the client just encouraged to relax? And the answer is yes. So for most people, they're just happy to lie back and relax. They might even have a light nap. They might enjoy listening to music. In certain situations, it could be that they get a little file and polish. They might even get a little foot treatment, maybe a basic foot massage, hand massage. That's up to the individuals. So you've got 30 minutes for this anesthetic cream to do its work. So removing the anesthetic cream is a standard procedure again, and you're just making sure that, again, the treatment area, the tissues are cleaned, prepped and ready to go. So probably if you asked your client at this time, and I did actually ask the client if their skin did feel numb, and the answer was yes, you could tell that it had taken effect. It's not numb to the point of discomfort, it's numb as in this cream has been effective, it's done what we need it to do, we can now continue with the procedure. So as you can see, Kasia is just making sure that there's absolutely no residue on the skin at all. I actually asked Kasia if you could, in theory, perform any part of the microneedling treatment without anaesthetic, and the answer was absolutely not. if you attempted to perform it without anesthetic, it would not only feel very painful, the way it was explained to me was there's so many needles, you can't tell that there's a batch of tiny needles in there. To us, it just looks as if there's some sort of implement touching the skin and releasing, but there's actually a whole collection of tiny needles there. So it'd be like getting tattooed multiple times, all at the same time, constantly over lots of delicate structures. Some areas of the face have thinner skin than others. Some areas are over bone, whereas others have got more adipose tissue. She said, absolutely not. Number one, you would really feel it. And number two, it would cause additional trauma to the skin and feel unbearable. Now, as you can see, what's happening here is that Kasia is now working over the face, sections at a time, with the microneedling tool. Now, what you can see here are the little blood spots, and that is the effect taking place immediately. Now, different areas will react differently, so you will have more vascular areas on the face. So for instance, the forehead tends to bleed more, but anyone who's possibly had their eyebrows waxed, sometimes when there's terminal hairs there and the type of skin structure it is, some people have bleeding there. Other people, when they have acupuncture, they get a little bit of bleeding if there's any needles in the forehead or between the eyebrows at the bridge of the nose. It's just a vascular area. There's a lot of capillaries there. So the client is staying relaxed because the client is numb. But again, you are only treating the areas that are covered with anaesthetic, and you would always avoid the eyes. Now, you don't have to hold on to the skin for long instantaneous movements. What you're doing is just pressing in and releasing, and what's happening is, as you're pushing in, the needles are just piercing the skin. You're not overstimulating at all. And then what's happening is you're seeing the results immediately, and there's going to be that almost instantaneous skin reaction as it starts to stimulate the collagen and the elastin production. Now, obviously, it begins instantaneously, but the treatment will be working over the course of the day, over the course of the next few days into the next week. So you start to see the result, but the result begins to kick in further after the treatment. I asked how long you could do the treatments for, and the answer was 20 to 30 minutes could be a shorter treatment. You could do longer. Obviously, the face is a very popular place to have this because of the effect that you're looking for, the brighter skin, the effect on fine lines and wrinkles. But actually, you can use it on different areas. You can use it on scars, on stretch marks, on the tummy, on the hands. As you can see with the nose, that would normally be an incredibly delicate area. Anything that's quite traumatic, imagine if it's a needle too, normally on the nose, your eyes would start streaming. So you can see that the anaesthetic cream has really taken effect there. Again, the client is staying completely relaxed. They will feel the pressure, they will feel something happening, but they don't feel any discomfort. You might get a little nerve reaction, a little twitch, but again, there's no pain. Now, as Kasia is an expert in many treatments and she has her own academy, there were lots of questions that I wanted to ask her. Some of the questions included how the actual machine itself works. So without going into too much detail, you can actually change the length of the needles per area. So the forehead, what was happening was she was adapting the different lengths of the needles to each area. I could see her just slightly adapting the tool that she was holding, and I would ask her why she was adapting it and what she was doing it for, and the answer was that she was actually changing the length of the needles. And what happens is, for health and safety, the needles are not protruding when you're working with it, but it's when you push it into the skin and it's protected by the plastic casing, that's when the needles come out, they pierce the skin, and then they retract back again. So for safety's sake, they're not constantly sticking out. I also asked if you can overstimulate an area, and the answer is, as with any treatment, yes, you can. So you're very much judging by the client's skin, the individual reaction, and you're just making sure that you're working your sections. If you break down any treatment area into the sections, then you can be sure that you haven't overstimulated and over-repeated in any areas. So when you have finished the treatment, I asked Kasia what the process was. So what you're using is sterilised water just to remove any blood on the surface. The skin has had a trauma, so it really is about being kind to the skin now. And when you look in the mirror, you will look red. There might be lots of little raised areas. To someone that didn't know you had the treatment, it could look almost like you've had a reaction to something, just lots of raised dots, tiny little bumps. Again, we know why it is, and it will settle down, but the client might be slightly alarmed, so you've got to just make sure that you explain to them that is a normal reaction. And it might be best saying to them that they might want to drive or even arrange for a pickup in case they weren't too comfortable going on public transport. These are all the things that you can just talk to your client about, in the same way that some people have a tan in the salon and they don't necessarily want to pop onto a bus or a train. Everyone's different, so have a chat with them first about it. But after the sterilised water has been applied to the surface to remove any residual blood, you're going to use a finishing product. And the finishing product can also be given away with the client too. And it's hyaluronic acid. You are very gently applying it to the skin, and you don't want to apply anything else, not even makeup, for a couple of days. But microneedling overall is another excellent treatment in the way of trying to stimulate the collagen and the elastin in your skin.